Good morning. It's Fit Old Dog here on a lovely day in North Carolina, and I want to talk to you today about whether you should go see your doctor if you have a pain. Now, I'm not going to tell you whether you should go see your doctor because that's your decision, and if you make the wrong decision and say I told you to do it, that'd get me into a lot of trouble. But I think before you go to the doctor, just think about the pain and what it is. Put a little bit of effort into it. Doesn't mean you shouldn't go, but think it through. Depends where it is. For instance, a while ago, about 10 years ago, terrible pain in my ear. But it turned out I was having a hard time sleeping. I was very stressed at the time in my personal life. But I went to see a doctor, and he looked in my ear and he said, "There's nothing wrong with your ear. I think you're probably grinding your jaws at night. You have TMJ." And he starts to reach for his prescription pad to write out a prescription. I said, "What's the prescription for?" He said, a very nice young man, he said, "Well, for a strong anti-inflammatory and for some Valium to kind of calm you down." I said, "Well, don't you think this is a warning sign and maybe I'll have a heart attack next?" And he looked at me very strangely and continued to write the prescription. I said, "I think what I'm going to do is I'm going to go home and I'm going to call into work and tell them I have to take a week off and plan that." I ran a lab, so I was in a position to make the plans to do that. And I'm going to start doing more meditation, long walks, and calm down by the way I live. He was kind of confused by this and said, "No, if you take these pills, you'll be able to go back to work." I said, "No, I won't do that." But he gave me the prescriptions and I told him, well, I won't take them. And when I left, I tore them up, threw them away, because I consider Valium to be an extremely dangerous drug. And within about 2 weeks, the pain in my ear gone away, everything was fine, I was back at work, things were much calmer, and that was a good decision. Essentially, I said, "No thanks, doc, I appreciate it, but no thanks." Another time, it was a whole other story. I'd been to a training camp in the desert, and I was doing a long swim, and the swimming pool started to sway around from side to side. I thought, what's going on? I was about 3,000 yards into a 5,000 yard swim. I guess this was about 5 years ago. So I got out and things kind of settled down, a little bit nauseous. Then I made the biggest mistake possible. I left the pool, cut the workout of 3,000 yards and left, and went and worked on my computer. And that triggered the most incredible vertigo you can imagine. It was terrible. I was completely incapacitated. I ended up being carted in an ambulance off to Duke Emergency. And on the way there, they gave me some Valium to control the vertigo. And that time it was, yes, please. The Valium really helped. And I was very grateful for it. It turned out I was very severely dehydrated, which affects your inner ear. So one time it was, "Yes, please, doctor." And the second time it was, "No, thank you, doctor." I made those decisions myself, in part based on my medical training as a veterinarian. But I think we all need to be involved in this process. You live with your body 24/7. The doctor, if you're lucky, will see you for 15 minutes every few weeks or months or years, depending what's going on. So what do you do if you have a pain? Well, let me tell you what I did with the pain I had in this left leg. And as some of you know, I have a big aortic stent, which keeps me alive. And it could clot or it could get displaced and cut off the blood supply to one or both of my legs if that were to occur. And some of the symptoms would include claudication, which means you start to walk or exercise and the muscles start to lock up. Well, that is exactly what happened about 3 weeks ago while I was training for a local race. This leg, when I started one morning to just do a very easy walk, it started to ache and then it started to lock up really badly. So I'm like, what's going on? Is it my stent? Have I got a problem? Is it clotted up? So I talked to a couple of friends of mine and they said, "Yeah, it sounds like claudication. Maybe you need to get that scanned." And so I thought about it, but I thought, wait a minute, let's just see what's going on. So I waited a while and the feelings went away. And then I got on my trainer bike and I started to spin, very, very light spin on my trainer bike. Oh man, my whole leg was aching. I couldn't do anything. The muscles were locking up. So I stopped and then I noticed I couldn't lift this leg. I just couldn't lift it. And then I remembered that I have very tight muscles on this side due to the way I sit. All my life, I've sat like this. Notice the way I am. This knee is very comfortable. About 3 or 4 years ago, I noticed that I never sit like this, and I can do it now, but it even takes a little work. Because what had happened was, as a result of always sitting one way around, these hip flexors, especially the iliacus, became very tight, and it still is tight in spite of a lot of work. But you'll notice his knee is much higher than when I sit this way around. It just drops down. That's because these muscles are very relaxed and loose, and these are very tight, leaving this open to a problem. So I thought, well, the two muscles that lift my leg mainly are the psoas muscle, the iliopsoas, goes up by the kidneys and can cause you back pain. Remember that if you have back pain, just to get your psoas to let go, and it may go away. And the iliacus, which is a smaller muscle off to the side. And I noticed when everything calmed down, I waited, I lifted my leg, and the discomfort started right in the iliacus. So I walked a little way, and everything started to lock up. I stopped, I stood there relaxed, and I pushed my thumb into the iliacus like I commonly do for the psoas if it's tight. And these muscles are very strange. If they are tight, you can get them to relax. You can get them to let go. You have this conversation with them, with your thumb. So I push gently into the iliacus. Remember, my whole leg is aching from walking 100 yards. Push gently into the iliacus. It lets go. Whoa, it melts away. And the pain throughout my leg vanished, completely vanished. This doesn't sound like claudication, does it? Anyway, what amazed me was when I studied it, was this pattern of tightness would spread from this region of the iliacus round to the back to the hip rotators. Then it would spread down my hamstring, even involve my quads, and eventually tighten up my calf. Stop, relax the iliacus, it will go away. So what's my approach? Do I go to the doctor for painkillers? I think not. What I have to do is get that iliacus to let go. I suspect it happened so suddenly because of a myotropic virus infection, which I'd had once before with my QL on the right-hand side. Why would it come on so fast when I'm not overtraining? And so slowly using passive recovery, resting, taking it easy, just swimming, not using and not engaging my iliacus, getting a bit of exercise, and then gradually getting back on my trainer bike, spinning very lightly, and then once I get off, working with my thumb to get that muscle to let go, and slowly going from passive to active recovery. Now, 2 weeks later, I can walk pretty well about a mile with no problem. May have to release it a couple of times. I'm back on the trainer bike, working up the wattage and the distance. But if I'd taken painkillers to disguise the problem, would I ever have known it was my iliacus that was in a state of spasm? No. I considered going to a physical therapist for dry needling, but it's really horrible having dry needling. I didn't want that. I'd rather take my time and fix it. And after that, I'll continue to try and get this iliacus and this whole side of my hips more in line like the other side. And that could take a long time. So in that case, I didn't go to the doctor, though I considered going and get a scan for my stent until I became confident it wasn't due to the stent. What did I look for? If it was blocked and I was getting poor blood supply, this foot might swell. I would get poor refill on my nail bed, so I squeeze a nail bed and it refills quickly. It means the blood supply is fine. And so that suggested that it was nothing to do with my stent. Now, if you don't know what you're doing, you might want to go see your doctor. But I wouldn't hurry taking painkillers because that disguises it and prevents you from working out what's going on. I'm not telling you to do this, I'm just telling you what I do. To me, a doctor, a surgeon, any other medical health professional, they're just members of my team. But at the end of the day, I decide whether to take the Valium, I decide whether to take the painkillers. Boy, when I had recently thoracic surgery, I had to reinflate this lung after the surgery. I couldn't do it without painkillers. The surgeon was right. So I took the OxyContin, which I hated, and it allowed me to reinflate that lung because it diminished the pain, allowed me to do it. So painkillers, doctors, surgeons, they're all tools in your armory of your health. But I think it's up to each of us to take responsibility for our life, and you can give that responsibility to a higher power, say your doctor, or you can take charge of your life yourself. Me, I prefer to do that. So that's it. It's your decision whether you go to the doctor, but I try to solve the problem first. I do what Einstein recommended about solving a problem. He said a very interesting thing. He said, if I have 1 hour to solve a problem, I spend 55 minutes understanding the problem And then the last 5 minutes trying to come up with solutions. And that's what I apply to my life, my training, my exercise, living with my aortic disease, and just enjoying myself generally. So that's it, over and out from Fit Old Dog, talking about how he lives his life. It's up to you how you live yours. Wishing you happy trails. Over and out from Fit Old Dog.